Hello, everyone. Thank you for joining us this morning. I'm Erica Harquist, Public Health Division Communications Officer with the Oregon Health Authority. Today, we're providing an update on the latest on the monthly briefing that we give for the state's ongoing response to COVID-19. And joining us today is Dr. Tom Jeanne, Deputy State Health Officer and Deputy State Epidemiologist. This is a friendly reminder. We always say this to please mute your audio and use the raise your hand function if you'd like to be added to the queue to ask your questions. So we'll be granting permission to record one by one. Many of you have already asked, so as you know, that can take a bit of time. So thank you for your patience while we grant you permission to record. And as always, this is an opportunity for members of the media to ask your questions and to hear from our experts. And with that, let's get started. Dr. Jeanne?
Thank you, Erica. Good morning, everybody. As Erica said, I'm Dr. Tom Jeanne, Deputy State Health Officer and Deputy State Epidemiologist with Oregon Health Authority. Thank you for joining us today for our monthly media briefing on the state's ongoing management of COVID-19. In addition to sharing an update on the status of COVID-19 in our state, I will talk about the two other important respiratory viruses we're concerned about this time of year. And those are respiratory syncytial virus, or RSV, and influenza. Finally, I'll touch briefly on where we are with the monkeypox outbreak. So first, COVID-19. It's been about 2 months since the Western States Scientific Safety Review Work Group affirmed FDA's and CDC's authorization of the Pfizer bivalent booster for people ages 12 and older, and the Moderna booster for people 18 and older. And just a month ago, the federal agencies and Western States Work Group approved expanding eligibility for those boosters to children 5 to 11. I know many parents and teachers breathed a sigh of relief when boosters were approved for 5 to 11-year-olds, who number nearly 343,000 in Oregon. That's a lot of kids whose risk for COVID-19 can be significantly reduced if they get the booster, and who would have less worry about getting and spreading the virus in school settings. We've seen a slow but steady increase in the number of people getting the bivalent boosters. As of Monday, November 7th, about 548,000 people, or 12.8% of those eligible, have received one of the available boosters. Nonetheless, we do expect COVID-19 transmission to increase as people gather indoors and as immunity from vaccination and previous infections wanes. Right now, the 7-day moving average of new confirmed and presumptive cases is hovering between 350 and 400 cases, with Dr. Peter Graven of Oregon Health and Science University predicting that COVID-19 hospitalizations, currently at 229 as of Wednesday, will increase slightly and peak at about 280 by early December. Oregon is seeing slow increases in the proportion of new Omicron subvariants with mutations of concern, such as BQ1 and BQ1.1. These new subvariants account for less than 10% of variants circulating in Oregon at this time. The BA5 subvariant still accounts for about 80%. Fortunately, the bivalent boosters provide protection specifically against BA5. We don't expect that this winter's COVID-19 wave will be as severe as last year's Omicron wave. We anticipate far fewer peak hospitalizations for COVID than we saw during the Omicron and Delta surges, thanks to high levels of population immunity. But there are other respiratory viruses we're concerned about. Oregon, along with other parts of the country, has been seeing rapidly increasing RSV activity, and that's the most common cause of severe lower respiratory infection among infants and young children. Symptoms include fever, runny nose, cough, and increased work of breathing. As of October 29th, the state met criteria for onset of the RSV season, and pediatric hospitalizations more than tripled between October 29th and November 5th. RSV can cause severe illness in both young children and the elderly. Children younger than 2, and especially infants younger than 6 months, as well as children with underlying medical issues, are at increased risk for hospitalization. Adults 65 and older, as well as those with chronic heart and lung disease, and those with weakened immune systems, are also at increased risk for hospitalization. RSV is transmitted through respiratory droplets, direct contact, and through touching contaminated surfaces. Pediatric hospital capacity is currently limited in Oregon and is expected to be heavily strained based on forecasted levels of RSV activity ahead. We've also been keeping a close eye on influenza, which we expect to circulate at higher levels this respiratory season than we've experienced during the last 2 years. You might recall that Oregon had a nearly non-existent influenza season during 2020 to 2021, when masking, physical distancing, and widespread closures kept the positivity of influenza tests well below 1% through most of the season. That will not be the case this season. Although influenza activity remains relatively low here in Oregon, it is increasing slowly. Statewide, we had 2% test positivity last week. We typically think of 5% positivity as a threshold for significant influenza circulation, and we expect to surpass that level within 2 weeks. Influenza will add to the pressure that will be placed on hospitals and health systems already dealing with the increases in other respiratory viruses like RSV. So what does all this mean? Some have been talking about a respiratory trifecta this season, or a triple-demic, as some of the media have called it. But as we like to say in public health, every respiratory season is a bad respiratory season. We do expect all three of these pathogens, COVID-19, influenza, and RSV, to circulate during this respiratory season at higher levels than we've experienced over the last 2 years. We don't know yet if this RSV or influenza season will be more severe in Oregon than pre-pandemic seasons. But nationally, we are seeing some alarming trends of early and in some cases, very high circulation of both of those viruses. So given this concerning picture, we need to work together to protect hospital capacity so that all of us have access to critical care when we need it. The COVID-19 pandemic has placed incredible strain on our healthcare system, and RSV is further straining systems now. We anticipate elevated influenza activity will soon add to this burden. The good news is we have reliable tools at our disposal. First, everyone should get a flu shot and make sure they're up to date with COVID vaccinations. That means a bivalent COVID booster for those who haven't received one yet, or if you're still unvaccinated, the 2-shot primary COVID vaccine doses, followed later by the booster. Make sure to get your COVID booster and flu shot soon so that you have protection for Thanksgiving and winter gatherings. We unfortunately don't yet have a vaccine against RSV. However, the general population can protect themselves through respiratory hygiene. That means covering coughs and sneezes, cleaning high-touch surfaces, practicing good hand hygiene, and masking indoors. We encourage anyone at risk for severe RSV illness, including young children and older adults, to consider masking indoors, especially in public spaces, during the RSV season, and to wash hands frequently. For children younger than 2 who are too young to mask, we encourage those around them to wear a mask. Masking, particularly in indoor public settings, is a powerful tool for reducing the spread of all respiratory viruses. When respiratory virus activity is high, everyone should consider masking indoors. And those at increased risk of severe illness should consider masking indoors, even when virus activity is lower. I encourage everyone to make a plan for how you will care for yourself and your loved ones if you do get sick. If you are at increased risk, or if you experience moderate or severe illness, reach out to your healthcare provider early. Ask them about antiviral therapies and testing. If your symptoms are mild, like a cold, please stay home. Don't go to the emergency room and potentially expose others to your respiratory virus. But always consult a healthcare provider if you have any concerns. Finally, I'd like to discuss the situation with monkeypox, or HMPXV. I'm happy to report that on Wednesday, November 9th, OHA demobilized its incident management team for the Oregon response to the monkeypox outbreak. That's because we've been averaging only 2 to 3 new cases of the virus per week for the last 4 weeks. We are now at 241 cases as of Tuesday, November 8th, which is an increase of only 11 cases, or 5%, over the last 4 weeks. By comparison, we were diagnosing 10 to 15 cases per week at the peak of the outbreak. By no means are we declaring victory against monkeypox. The virus continues to circulate in our community, although at a significantly lower rate than we saw in the early days of the outbreak this summer. 10,993 first doses and 5,199 second doses of the Jeanne vaccine have been administered so far, thanks to extensive engagement and partnership with community organizations, local public health and tribal health agencies, health systems, and federally qualified health centers. We continue to encourage those who receive the first dose to get the second dose as soon as possible. This campaign includes continuing with communications and direct outreach through community-based partners and local public health authorities to those who are eligible for a second dose. Early next week, the OHA case support team will also begin calling people eligible for the second dose to remind them to get the shot. As we have emphasized throughout the outbreak, the first dose of the monkeypox vaccine starts a person's protection against the virus, but maximum protection comes 2 weeks after a second dose, which may increase the length of time a person is protected. Those who received one dose are eligible to get a second dose if it has been at least 28 days since the first dose. We will continue to share information with people most affected by monkeypox at the places where they're at highest risk for transmission until we can finally bring this outbreak to a close. And with that, I'm happy to take questions.
Thank you, Dr. Jeanne. We are waiting for those of you to put up your hands if you have a question. I will add you to the queue. Just use the raise your hand function. I'll happily call on you. Oh, okay. OPV. Amelia Templeton. Go ahead, Amelia.
Hi, thanks. You mentioned that pediatric hospitalizations had tripled over, it sounded like about a week. Can you give us the numbers? That sounds like a lot, but I'm aware that we may be talking about a pretty small number of absolute hospitalizations. So can you just share a little more about that?
Yeah, thanks for the question, Amelia. I think we'll have to get back to you with the exact numbers. They are, the hospital situation changes daily. We do know that, capacity, as I mentioned, is a real concern because of those youngest children who get very sick and may need ICU level care. We currently only have just a few pediatric ICU beds available statewide. And this is happening all around the country right now. It's a dynamic situation. And so we've really been working hard to support coordination of patients across the state to really make sure that everybody can get the care they need, including the youngest and most vulnerable. But in terms of absolute numbers, they are a pretty small number of kids who are hospitalized, but we'll have to get the details to you later.
So essentially what you're saying is that the increase in RSV and in pediatric hospitalizations, sorry, let me slow this down for a second. So you said there's only a few pediatric ICU beds available statewide right now. Is that due to RSV? Are the kids being hospitalized with RSV needing ICU level intervention?
Yes, that is certainly part of the situation here. As I mentioned, the youngest, the infants really are the highest risk for severe illness. They're the ones who are more likely to need oxygen or other supportive care if they do come down with RSV. And we are already seeing that increase in Oregon, although it's not to the levels that other states have seen at this point. I can add that we sent an alert to healthcare providers statewide yesterday, advising them of the situation and steps they can take to help address the surge in pediatric respiratory virus activity. And we sent a communication to hospitals today, asking hospitals to take steps to maximize their staffing for care of children, as well as spaces and supplies for overall capacity. And encouraging pediatric and subspecialty providers to manage their patients locally as much as possible to reduce the need to transfer to specialty pediatric hospitals. So really trying to optimize the resources we have to make sure that everybody can get the care they need.
Thanks.
Thank you for that question, Amelia. Our next question comes from Daisy with KGW. Go ahead.
Thank you so much. Yeah, so I just had a question. We just actually yesterday did a story with a mother whose, I believe, 7-year-old daughter is fighting RSV right now in the hospital, hospitalized. And for those parents who might have watched that story or will see that story and hear that, RSV is a serious thing, Tom, what would you like to let those parents know, or what can they do for those youngest, most vulnerable kids to potentially get RSV?
Yeah, thanks for the question. It's certainly a severe illness in anybody of any age is concerning, and we feel for that for those people. The youngest kids, are more at risk, but certainly older children and adults can have severe illness. Again, this is why we're trying to make sure that our healthcare system can support those who are in need, and also just for new parents of infants. We know that having contact with the parents is important, and that those first 6 months of life are really the most critical, and it's also a vulnerable period. So it can be scary to have an infant who has difficulty breathing and gets some of these symptoms, but we have excellent pediatric care in Oregon, and certainly if you have concerns about any parents have concerns about illness in their children, don't hesitate to call your healthcare provider and seek care as appropriate. However, I will say that for most people, older children and adults, we've all been exposed to RSV, and for many people, it's really just an illness like a cold. So if you do have mild symptoms, just stay home and try not to expose others.
Thank you for that question. It looked like Ben Botkin with the Oregon Capital Chronicle had a question. Ben, go ahead.
Oh, my question had already been asked, so thanks. I'm good.
Okay, great. All right, we are standing by for more questions. And we see the follow-up inquiry from OPB about getting a link to the advisories and follow up with the actual numbers of pediatric hospitalizations for RSV, and we can provide that, certainly. Go ahead, Amelia.
Yeah, I'm just also wondering, the Tableau data that I'm familiar with, I think, is just adult ICU capacity and hospital bed capacity. Do you guys publish a dashboard, or is there a way to toggle it so that we can see pediatric ICU capacity? If this is a public conversation we're going to be having for a while this winter.
Yeah, we can get you a link to that information, Amelia.
Thanks.
Okay, we're going to give it a couple more minutes, maybe one or two, and we'll see if there's any other members of the media that have an inquiry for us this morning. And Ben, we also see your mention in the chat that you'd also like the advisories and pediatric hospitalization numbers too. So noted, letting you know that we do see that. Okay. And you as well, Daisy. Okay, that seems like it's all of our questions for today. Thank you so much for being here, and you all have our email. Again, this was an opportunity for the media to ask your questions. The public is always encouraged to ask questions during our Facebook Live events, so we do appreciate this, and we're going to be sending out a sort of after action news release after this with a recording of today's media availability. So watch for that in your inbox as well as the follow-up questions that you all have asked. Thank you again to our expert, Dr. Tom Jeanne, for joining us today. And thank you all for being here this morning.